So I've got a big canned lecture, but I'm going to go off of that right now. And we're going to go do some rounds here. Now, what I do, by the way, you can see I do this by laptop. I can also do this, I have in my study at home, a big double screen. And on the big double screen, I have, I was doing this morning before I came here, I have where I look at the patient here on this screen. And on this screen, I have the electronic medical record and the x-rays. So I can look at the patient, look at the medical record, what people say, I can look at the x-ray, look at the lab data, and I can look at the patient, and then I go to my website, I enter that as a bill, I dictate by Dragon, and I fax to the hospital. You don't do any of that efficient here at all. You don't. Sutter's way behind. You don't even have an electronic medical record in this hospital. You've got bits and pieces, and no one's put it together. It's amazing. I go to a hospital like Mendocino Coast, where we're going to go in a little bit. They've got a wonderful system of records, and so does Willis. We're going to Willis right now, and Ukiah, but you don't. It's amazing to me the way the little hospitals are beating you in medical records. I do much better for the electronic medical record. I got all the data. Otherwise, they've got to fax stuff to me, but I see the patient. It takes a big fast fax machine. I have a big fast one in my home. Got to fax, a chart within minutes, that type of thing. But when I travel, I take a laptop with me. For example, when I go to Sea Ranch, where I have the home up there, I just take it up there, and I take care of patients there. I was in the city last week seeing a play in a stayed overnight in a hotel. I took that with me there, because I was on call from Mendocino Coast over the weekend. And I was up in San Francisco seeing South Pacific. Okay? It's a good musical. Okay. So here we are. Now we're going to go to, take it to, I have two people, first of all I'm going to go to Willis. I've got two people in the ICU there. I've got a gentleman with H1N1 pneumonia who's doing badly. And yesterday I decided to add steroids to his regimen. We'll see how he's doing. That's a desperate measure when a physician who's a pulmonologist adds steroids for viral pneumonia. It's desperate, okay? But I'm doing it. I also see a lady there who came in yesterday with aortic stenosis and pulmonary edema. She was intubated. I extubated her yesterday. She got in trouble last night. I'm slowly diuresing her. I've got her on BiPAP. I'm trying to not intubate her again. She's 91. She's got severe aortic stenosis. She's not a surgical candidate. Okay? Then we'll go to, and I'll tell you each place we go with the patients we're going to see. These are people I'm consulting on. So first of all, we're going to go to Willis. And this is Howard Memorial Hospital. And here we go. I usually work with a nurse practitioner, too.
Ann?
Hello, Ann. Dr. Goose.
Hello, Ann, beside you, Dr. Ann.
Hello, Ann. You there? Hi. Hello, Bobby. Is Ann here?
Ann is here, awaiting your arrival.
Good. I'll just go out
Made
there.
it prep. Oh, here's a chest x-ray for you to look at.
Okay, this is on a gentleman with...
No, this is Mrs. Halverson.
Okay.
Our lady in bed 2. This was yesterday's, and this was today's.
Okay, let's look at it here. Now, it's clear here. Her pulmonary edema is worse. Hello, Ann.
Hi.
Ann, I want to introduce you. We've got a medical audience watching, Ann. This is Sutter Grand Round. This is Ann, a fine nurse practitioner who's up in Willis. Ann, that x-ray is a lot worse, isn't it? Now, let me hone in on that a little bit here. I think a little bit better here.
Okay.
Okay. Well, she's got cardiomegaly. She has, it looks like bilateral effusions. And today it's a lot worse than yesterday, particularly on the left side. And I think
her white count has gone from 13.7 to 15.5, and her absolute neutrophils are 12.9.
Does she have bands?
I didn't see bands.
Okay. She was intubated yesterday in the ER in Mendocino Coast before she was shipped down to you in Willits at Howard Memorial. She could have aspirated.
Yes.
And this looks asymmetric. It looks more on the left than the right. Really, pulmonary edema generally should be symmetric. We might have a superimposed aspiration pneumonia in this lady when she was intubated. And does she have any allergies?
No, and we looked at Sanford and Primaxin. What would you say?
I'd reserve Primaxin for a really very resistant infection. I'd go much easier on her. And what I'd do would be to put her on ceftriaxone a gram a day and clindamycin. She's an older lady, 600 milligrams IV Q8 hours.
So ceftriaxone, 1 gram?
1 gram a day. That'll cover your pneumococcus and H flu and all the normal things. But the Clind is the best anaerobic drug for an aspiration pneumonia.
And then that would be what the dosing on that, I'll look that up, I guess.
600 milligrams, IV, Q8 hours. There's also a 900 milligram dosing, but you do that in people who are younger with better renal function. Her creatinine is 0.9, so she's
Her creatinine clearance is like 18.
right. So we got to be careful. The ceftriaxone, no trouble with the low creatinine clearance, and there shouldn't be any trouble with the Clinda. So we'll do those two. Before you do it, see if you can get have her cough up a good sputum sample, and we'll look for, we'll do a gram stain on it and a culture, just in case we're missing something, then we'll change antibiotics further on. Is she
Okay,
febrile
and then
at
should
all?
we also check a urine?
Yeah, I check that. Yeah, we'll cover urine
Okay.
too. You know, I think urinalysis is fine. But
Okay, and then I'm sorry, you broke up on that dosing on the Clinda, that's
600 milligrams IV,
600.
Q8 hours,
Okay.
3 times a day.
okay, thank you.
Okay. And the impressive thing about X-rays is asymmetry. The left side more than the right. Okay, let's go take a look at her. Okay, so
Okay.
she's on BiPAP now.
She, we just took her off of BiPAP because she's having a little bit of clear liquid breakfast.
Well, that's good. You just put her on.
Family tells, family says that she really likes oatmeal.
Good, I do too.
Could she have a little oatmeal?
Absolutely.
She's doing fine with
I'm off her oatmeal. Hi, Bobby. This is a comment to
Her
everybody here. You gotta
stats
know
have
your
kind
nurses'
of-
names. All right? Okay.
Her
Okay.
stats dip a little bit off the BiPAP.
Good morning, ma'am. Hi.
This
How's
is your
it
robot doctor.
Hi. I'm the old robot doctor. Remember me last night?
You're cutting out, my dear.
Well, I'm trying to get a little bit closer and see if I can get a little better look here. Now, ma'am, how do you feel today? Better than yesterday. Well, good, good. Let me get up in the sun. Look at your face a minute now. Good. Okay. Now, you look pretty good looking at you. Is there any fever, Bobby?
She does, well, it's 99.5 axillary.
Okay, so probably is.
She was feeling warm and cold through the night, not chills exactly, but
Yes, you look pretty good right now. How's that oatmeal?
No oatmeal yet. I
No
wanted to
oatmeal
make
yet.
sure that you
Oh,
really-
too early. Premature on the oatmeal comment. Sorry about that. Are you short of breath, ma'am?
Not much.
Not much. Are you having any chest pain when you take a deep breath? No. Are you coughing anything up at all? Got a
yeah,
cough,
she
right?
is coughing up some yellowy tan thick stuff and having some trouble getting it up, and
Could you get a
I
sample
think it
on
hurts
that,
her
Bobby?
chest when she coughs. Don't you think it hurts a little when you're coughing? It hurts her shoulder when she coughs.
Why don't you get a little bit of a sample on that? Get something that looks good and pure, and then we'll send it for gram stain and culture and sensitivity.
Okay.
Okay, now she looks good on BiPAP. I don't think she needs to be on BiPAP unless she gets some respiratory distress, or you can't keep her O2 sats greater than 90.
Yeah, I guess she had some real anxiety during the night and her sats were 88, so they put her on the BiPAP, which helped. And she's about 93 on BiPAP. I took her up, so we put her on some high flow. I got her on 8 liters with this cannula, but maybe a high flow at 10 or something would help.
That'd be fine. And you know, she does need BiPAP. It's just a bit uncomfortable unless you really think she's in distress. Then you can do it. I'm looking at her right now. Her heart rate is 90. Her O2 sats are 90. Respiratory rate 17. Blood pressure is
118 over 47.
118 over
Yeah,
47.
those are all fine. Looks good. So,
But that's still on the neosynephrine at 50 mics.
yeah, she needs that. Remember, we over-diuresed her yesterday and had to give her fluid back and put her on neosynephrine to get her blood pressure back. We gave her Lasix yesterday. She diuresed 2.5 liters. I had to give her 1.5 back to get her blood pressure back. And that's because she's got tight aortic stenosis. We got no leeway. The problem.
Yeah, I got out of there just in time.
No, Bobby. Okay. And I think we're doing okay right now. But let's do the following. See, I lost the connection there right there. That can happen at times. We'll come back on it. Now this, occasionally this will happen. I'll dip out and I'll have to come back on in. What happens is the internet failed on me right there. Let me disconnect and come back. See if I can do that. I'll come right back to it there.